Dr. David McFadden here, board-certified prosthodontist in Dallas, Texas. Today I want to talk about restoring missing teeth with dental implants. For patients who are currently missing all their teeth or soon to be missing all their teeth, there are 3 different basic implant treatment types that I want to discuss. Many dental implant practices propose the extraction of all the teeth to make room for implants. And at the Dental Implant Center, we don't believe in that. We think a good tooth is still worth keeping, and we like to work around a good tooth with implants whenever it's possible. One of the difficult things that we're going to encounter in today's discussion is defining the differences between the 3 treatments, because in many ways they're very similar. Option number 1, which I call the highest level option, is that of a fixed implant restoration. And this is where we put crowns and bridges directly on the implants. Most people have had crowns or bridges on their natural teeth, especially people that are ending up in a situation where they need to have dental implants. So the first treatment option for patients missing all their teeth is to have crowns and bridges placed back in their mouth, but on implants instead of on teeth. So here's an example of a person missing 3 teeth where we used 2 implants and a 3-unit bridge to replace that, just like we would if the teeth were still present with the one missing in between. So to take this to the next level, the best treatment that we can render with implants is the one that uses this technology for the whole arch of teeth. So we might have 4 bridges in one arch, but it would replace 12 to 14 teeth on a limited number of implants with crowns and or bridges on top of the implants. So the second option that we have to offer patients missing all the teeth in one arch is what's called a hybrid prosthesis. Now this has become, the popular name for this has become the all-on-4 treatment or the teeth-in-a-day treatment. And this is wildly popular in the United States. It is a denture-type prosthesis that is larger than the first option that I discussed. It is an entire prosthesis on a titanium base that has plastic teeth. Very comfortable, but much larger than the first option. So this is the next level, the second level or the second tier of treatment. It is screwed into place or it is cemented into place, and neither of these first 2 options can be removed by the patient. So they're highly functional and they're very comfortable. So that brings us to option number 3. Option number 3 is a removable implant prosthesis. It's a denture that actually snaps down onto the implants. We like to use 4 in this situation, but 2 can be used as well. So the denture actually snaps into place and is stable because of the attachment between the abutment and the attachment inside the denture. It's as rigid as we, the dentist, want to make it. So it's still a very fine option, and more of our patients do this than either of the other 2. It's the most cost-effective. The downside, though, is that it's large. It's a denture, it's still a denture, and it has attachments inside of it so that when we place it in the mouth, there's something that retains it, unlike a conventional denture. So our last option to discuss is the old-style restoration of teeth, and that's just a complete denture. You probably saw these, your parents or your grandparents may have had these, and most people struggle a lot with a denture because it moves. There's nothing to retain it, nothing to keep it in place. So people are constantly trying to balance their dentures as they're chewing, as they're speaking, as they're laughing. So we call this kind of an antiquated treatment. It's still available for folks and we can still make them look very nice, but they're not very comfortable and they're not very functional. So we call this the final option for people missing all their teeth. One of the most common questions that we get in implant dentistry is, how much does it cost? And that's a great question because the ranges vary tremendously. So if you think about buying or purchasing a car, we have a range that's very similar to a person going out and trying to find what car is appropriate for them from a price standpoint. So we literally offer everything from the BMW to a used AMC Pacer. And I would consider the dentures probably the used AMC Pacer. But above that, our other options literally are just at many different price points, much like purchasing a car. One of the biggest reasons that I'm here today to educate the audience on the different options is that many offices, especially the corporately owned dental offices, only offer one treatment, and that treatment is the hybrid denture. That's the treatment that they've found to be the most profitable for their model. So I certainly want patients to steer clear of those places where they're only getting one option. The right way to treat a patient is to give them all their options. Different price points, different functional levels, different comfort levels. And that's what we strive to do at the Dental Implant Center. There's also a misconception about the beauty of dental implants, or what we call the aesthetic outcome. A lot of practices claim that implants never look as good as teeth, that they just have a more prosthetic look to them. And our goal at the Dental Implant Center is that when you smile, there's no difference between a beautiful set of natural teeth and the implant treatment that we render for you. So in summary, I'd like to invite you to our practice of board-certified prosthodontists so that we can help you understand all your options and pick the one that's best for you.